So Ben, tell me why someone should choose home health therapy versus something like skilled nursing.
Okay, so home health is really designed to kind of fit into this little gap. So home health is designed for those patients that aren't healthy enough or don't have the energy to go to an outpatient facility,
Okay.
Whether it's an outpatient physical therapy or occupational therapy or even outpatient nursing care. They just don't have the energy for it. They're too tired. But at the same time, they're not sick enough or they're not ill enough to need the full-time skilled care of like a skilled nursing facility or the hospital where they have that 24-hour care. And so we kind of fill in that little gap in the middle. Is
Okay.
why you would pick us over them.
Okay. So somebody that, I mean, I would imagine that a lot of folks, at least from my experience, would rather just stay at home too.
True.
So is there kind of that, do you kind of allow people that opportunity to say, I'd rather stay at home, or is there some doctor saying, no, you really need to go to a facility? Does that make sense?
There is. As I've said before, the physician is the one, the doctor is the one that is
Okay.
overseeing the plan of care.
Okay.
So they help work with the patient as to which one is the most appropriate.
Okay.
It is very common while somebody is on home health care that they start getting better, they start feeling better, have more energy, and they stop being homebound, which is a requirement for Medicare and most other insurances.
Oh, okay.
Once that point happens, then we work to transition them into an outpatient facility.
Interesting. Okay. So when should someone have home health therapy services?
So most of our referrals will come from a skilled nursing facility or from the hospital, but that's not actually required. What I would recommend to people is if they start noticing that they've lost the ability to do something they normally would have no trouble doing, that would be the time to go start talking to the doctor and say, this is going on, try to figure out why. And it's a lot easier to treat these problems early. So, and while you're talking with the doctor, that's when you also determine, would you be homebound? Would an outpatient be appropriate? Would home health be appropriate? And so that's the point where they should be starting to think about it.
Okay. So when it's not necessarily a choice of the patient, right? It does have to be a referral from a doctor in order to receive home health?
Yes. Like I said earlier, the physician has to oversee the plan of care.
Okay.
So it has to have at least some aspect of the physician.
So we don't have
starting
just random people finding you in the phone book and calling you necessarily, although they may, but you're going to tell them, no, you need to go talk to your doctor first and receive a referral.
Yes.
Okay. Well, that's interesting, Ben. Thank you so much for coming and talking about home health. I know we do have a lot more questions for you, but we're out of time for today. So will you come back and chat with us again some more next time?
I'd love to.
All
Thank you
right.
for having me.
Great. Thank you so much.
Thank you.